Many American hospitals are in a cash crunch, causing their emergency rooms to be closed in the middle of the coronavirus crisis. Conte shows us how it's creating life or death consequences and what healthcare workers say can be done to fix it.
It sits in silence, in emptiness, perhaps in perpetuity. The death of Cumberland River Hospital has thrust this place into darkness.
We are seeing a huge divide in healthcare among Americans.
Johnny Presley is the owner of this small rural hospital located in Salina, Tennessee, a town of 1,400 people, a town that no longer has an emergency room.
When people can't live in the rural communities they grew up in without having adequate access to health care, then it's almost like you're in a prison.
Months of fighting with Medicare for reimbursement payments finally led to the inevitable.
I used over $2 million of my own funds to keep this thing open for 4 months.
Hospitals across the country are struggling now more than ever, as patients are still avoiding elective surgeries because of COVID. Those are the bread and butter of most hospitals' bottom line.
It's thrown all hospitals into a negative cash flow issue.
Not just about the money, though.
When I fell down the stairs, I actually woke up from the fall.
When Stephen Hendrick fell down the stairs earlier this year, help was only a 5-minute drive away.
It means everything. It really does to a small community like this.
With the hospital now closed, though, the nearest emergency room is an hour's drive away. This is the reality of rural health care in America.
So many people are going to die. They're going to die because they don't get the emergency care that they need.
Since 2005, a staggering 174 rural hospitals have shut down nationwide, 15 of those closures happening this year alone, leaving a vacuum of care in their absence. Texas and Tennessee lead the nation in hospital closures. By the end of this year, hospitals across the country are expected to lose $300 billion, a staggering statistic that ripples far beyond the walls of any emergency room. In most rural communities, hospitals are often the single biggest employer in town. When Cumberland River closed, nearly 100 doctors, nurses, and staff were let go.
I think it's awful, because we could have a hospital.
By some estimates, 2020 may end up claiming the lives of nearly 200 more hospitals.
To keep our hospitals open in the middle of this pandemic, it's going to take the government to intervene.
With federal aid, Johnny Presley could reopen the hospital tomorrow. But so far, his pleas to politicians have gone unanswered.
I think it's just a travesty that this country is going through. This country is so politically polarized right now that the most basic human needs of food and health care in this country are now being overlooked.
Rural lifelines on life support, with American lives hanging in the balance.
The ability to take care of those folks right now is just not available.
In Salina, Tennessee, I'm Conte.